So it's carbon monoxide season, and I split my time between emergency medicine and hyperbaric medicine, and I think this is perfect time to talk about this, this complex sort of diagnosis and therapy. I've got no disclosures for this talk. This is our tank. We use this to treat our carbon monoxide poison patients. This is in the basement of the shock trauma building in Baltimore, University of Maryland. I've got 3 pearls and then 3 myths to go over for you, and then we'll summarize at the end. So as you all know, carbon monoxide doesn't have an odor, doesn't have a color, and it is the leading cause of accidental poisonings and deaths worldwide and in the United States. And the first myth I wanted to sort of touch on is this idea that carbon monoxide or carboxyhemoglobin, which one of them is the one that's causing the problem. And we were all taught in medical school that, and in residency until late, that carboxyhemoglobin causes this sort of functional anemia, and that's the way to think about it. And that's absolutely wrong. It's actually carbon monoxide, the molecule, that you can think of as a gas neurotransmitter. And what it does is it activates lots of sodium channels, it increases nitric oxide levels, and it basically sets off this cascade of inflammatory abnormal things that happen in the brain and cause brain damage down the line. And so this was, if you want to think about it this way, you take care of a lot of anemic patients, but they don't come in with headaches. Anemia doesn't cause nausea, maybe dizziness. So this was all demonstrated in the 70s, very sort of an awesome study where they took dogs, they exposed them to lethal doses of carbon monoxide. The dog dies, they take its blood, they transfuse it into a healthy dog, and the healthy dog now with carboxyhemoglobin levels of 60, 70 is completely asymptomatic. It's the gas that causes problems. The carboxyhemoglobin is just a tool to make the diagnosis. The next myth is this idea that we save lives in the hyperbaric chamber. We don't. If you make it out of the carbon monoxide exposure and you're alive, there's only a 3% mortality after that. So we don't save lives. We're in the business of saving brains. So it's delayed neuropsychiatric illness that we worry about. The patient might come out and may be asymptomatic now, but they were exposed to high levels. It's tomorrow or maybe a month later that their spouse isn't going to recognize them because they have these personality changes, or they have Parkinson's, or they have this sort of inability to do basic math anymore. Okay? And that's what we're trying to prevent. It's not death that we're preventing, we're saving brain. Brain damage that happens down the line. And this is a big one. This is another myth. I was taught that you need an arterial blood gas, right? You need a pH, you need an arterial carboxyhemoglobin level. Absolute nonsense. You just need a simple venous blood sample, right? You can send it for your venous gas if you want, send it for that carboxyhemoglobin level, and if you're going to call me in the middle of the night, I would love to have a lactate level and a troponin. That's all you need. And certainly you don't need to repeat the level. By definition, if you step out of the carbon monoxide poisoning environment, your hemoglobin level, your carboxyhemoglobin levels are going to go down. If you're exposed to, normal baric, like non-rebreather face mask, it's going to go down by half-lives every hour. If you're just breathing regular air, every 6 hours. So the levels are going to go down. We don't care about the levels anymore. We've made the diagnosis. All right. Now, we're going to talk about some pearls. So your EMS providers may give you some data using different devices. They might come with a little handheld carbon monoxide detector, and that number is going to be in parts per million. Doc, there was like 200 parts per million exposure in this room. That's a lot. And that's different than this machine that they might have. This is a RAD 57, it's the Massimo product. And this one will give you actual carboxyhemoglobin levels, very similar to that blood sample you're sending. Right? So this one will give you actual numbers, like 15%, 20%, versus the pulse ox machine, which is completely useless. You're going to have falsely elevated pulse ox values because you can't differentiate, that those machines can't differentiate between carboxyhemoglobin and regular oxygenated hemoglobin. All right. Now, a little pearl about drywall. So carbon monoxide is such a tiny molecule that it can diffuse through painted drywall, 2x4, and then painted drywall, and expose other rooms, other households. So how does this apply to you? You have a patient who has exposure to carbon monoxide by history, but you ask them, do you have any combustion sources in your house? No, doc. and you may be fooled into sending them back home to a death trap. Why? Because it was their neighbor. They live in a row house. It was their neighbor who didn't pay their bills and their gas was cut off, and they borrowed a generator, and they're running the generator in the basement of the next door row house. And everyone within multiple drywalls is going to be exposed. So consider that in your next patients. And finally, and this is our last pearl, is consider cyanide toxicity in patients who are exposed to smoke, especially from burning plastics, right? So certainly there's going to be carbon monoxide exposure there, but I want you to think about cyanide toxicity, especially when you send that lactate level, the lactate is above 8, right? So lactate of 8, smoke inhalation, altered mental status, that equals cyanide kit, right? This is hydroxycobalamin. It's going to bind all that cyanide and turn it into vitamin B12, okay? So the dose is 5 grams. And so those are all the pearls and pitfalls I have for you. I want you to think about the fact that carbon monoxide is the actual killer and not carboxyhemoglobin. Carboxyhemoglobin is what is detected to make the diagnosis. You don't need blood gases. You certainly don't need to repeat levels. It's hyperbaric oxygen therapy that decreases brain damage and not just breathing regular oxygen value, normal baric oxygen. We talked about devices, parts per million versus actual RAD57 values that give you carboxyhemoglobin levels. Remember, it's such a small molecule, it's going to diffuse straight through drywall, painted drywall. And then consider cyanide toxicity in your patients. Now, this is what gives me job security, right? So in the wintertime, it's cold, and people get this is a $200 from Home Depot generator, and it's got a huge yellow sign on it that says, do not operate indoors. And this is where I get all my patients from. And then in the summertime, it's the person who didn't want their steaks getting wet, so they brought the barbecue indoors in the garage, and they continued to grill, and then Grandpa's found unresponsive in the garage. Thank you.